Hey there, this is Dr. Shivaam, and we were doing the live session. Anyhow, it got interrupted, but no worries. Topic for your Neetpg examination, so do subscribe to the channel. I also teach at an academy where we detail, and our today's session and our regular sessions on this channel will be based upon the important topics you need to the must know topic that you should know in very short time and very hard. So but before that, just few things to remind you that consider your present day as an opportunity. Consider it as a burden or something that is very difficult for you. So consider it as an opportunity, just checking whether things are getting recorded or not. So just be a few minutes with me. Yeah, so everything is right. I was just checking. Opportunity for making your future a better version of yourself. So never ever downgrade your efforts, and you're pushing efforts and you will be doing wonders in your career. So this is not just for today's thing, but is in your career. Now, starting with the first question, can you telling you which sign is this angiographic finding telling you? So first, let us see what from it. Here you can see a vessel which is splayed around some mass. It is also a vascular mass. So here you can see the vascularity of the tumor and a big vessel. See the lumen of the vessel. So a big vessel. What big vessel can it be in neck? Contrast enhanced CT scan of neck. Here you can see the common carotid is dividing into surrounding a tumor. So basically this tumor is the carotid body tumor, and as discussed this topic, because this carotid body tumor has questions from each subject. If you say pathology, yes. If you say surgery, yes. So this is important and high yield topic for you to know. So what is this sign? This sign is called Liar's sign. Okay. And what is this tumor? This tumor is carotid body tumor. Now, so Liar's sign is seen in carotid body tumor, right? So it is just a that is playing a part of internal and the external carotid arteries. Now tell me, what is this? What finding you are getting? So if a carotid body tumor on axial section and you are seeing some another peculiar sign. So there is some MRI on T2 weighted images is showing you some flow voids, and by flow voids what I mean is it is showing you a specific salt and pepper pattern. So in your journey through Neetpg you have seen different salt and pepper appearances. This is among one. So the paragangliomas, extra-adrenal paragangliomas. So these are extra-adrenal paragangliomas which are basically vascular lesion and they encase many a time this carotid artery. So salt and pepper appearance is another body tumor. Now what else? Can you tell me this histopathological finding? So again, this histopathology is associated with carotid body tumor or paragangliomas. So see how important it is for you to know this. The typical Zell-Ballen pattern. So remember if you have read your Robbins or if you have read your Hirschmohan analogy, you must have remembered this figure from your books. So this is a typical Zell. The tumor cells are predominantly chief cells with round hyperchromatic nuclei dispersed in chromatin and granular cells. Just remember this figure for the sake of answering in examination. This is Zell-Ballen pattern typical of paraganglioma. Now, moving to another thing, again the Zell-Ballen pattern, which is highlighted by S-100 protein immunohistochemical staining. So this is Zell-Ballen pattern seen in carotid body tumor. So I think you it is. What all you got? Liar sign. What else you got? Salt and pepper sign on MRI. So this was on MRI T2 weighted image. Liar sign was in angiogram. And on histopathology, what you got? Zell-Ballen pattern. So don't ever mistake this. I believe that you won't ever mistake this now. So these paragangliomas many a times are seen with different syndrome, a part of genetic syndrome like von Hippel-Lindau syndrome, neurofibromatosis type 1, MEN 2A and MEN 2B. So all these syndromes must be at tip of your tongue. So we'll make separate videos for all of them. That is why I'm saying it's too important for you to subscribe and stay aligned with whatever I am telling, because these are the things that if you revise in your last 15 days, they are going to benefit you immensely. Believe me, immensely. So people have already benefited from it, and I want you or your juniors to get the benefit also. So whenever I'll get time, I'll make something for you, something useful, finding time from my schedule. So what is the treatment of choice? You are going to excise this tumor. So any tumor you will, if it is benign and if it can be excised and removed, you will do the surgical resection of the tumor. But what is important is all the anesthesia people fear this tumor. They fear the carotid body tumor because many a time they release the adrenergic, means sympathetic, they activate the sympathetic system, and that is why they always give adrenergic blockage before starting the surgery. And in urine they will do the urinary VMA test. So vinyl mandelic acid, which is a byproduct or metabolic product, they will test for VMA and see whether this carotid body tumor is of secreting type or not, and they will do the adrenergic blockage. So if they give a scenario in this carotid body tumor, you should be knowing that preoperatively one step is needed, that is adrenergic blockage. So considering the high vascularity, preoperative embolization is many a time also done so that you embolize the supplying artery and bleeding is less. Now coming to another important topic, that is Prusik space. So if I ask you the boundaries of Prusik space or a MCQ based on it. So if you see here, this small space is your Prusik space. So tell me, the Prusik space is bounded below by, the options are fibers of lateral malleolar fold, Sharpner's membrane, lateral process of Malleus or neck of Malleus. So I'll wait for you to comment and let me know what is the inferior boundary of Prusik space? It is bounded by which thing and what is the importance, why I am discussing. So I don't discuss anything which is irrelevant. I always value your time. Again, this small space, rounded space, is the Prusik space, which is bounded above by lateral ligament. So don't forget, above by this strand, this is the lateral malleolar ligament. Below by, so that was the question. Below by, so this, it is inferior by the lateral process of malleus. And so you just see, this is your medial boundary by the neck of malleus, below by lateral process of one is lateral by the pars flaccida. So very easy. Here will be laterally will be your pars flaccida. Okay. Superiorly or above by the LML, lateral malleolar lateral process of malleus, and medially by the neck of malleus. Right? So laterally by Sharpner's membrane or pars flaccida, medially by neck of malleus, superiorly by lateral malleolar fold, and inferiorly by lateral process of malleus. Prusik space is bounded inferiorly by lateral process of malleus. Lateral malleolar fold was above or superiorly. Sharpner's membrane is lateral medial. And why it is important? Because it is the site of initiation of retraction pocket and the cholesteatoma formation. So acquired cholesteatoma, this is the potential space which may first get involved during extension of cholesteatoma. So very important site. So ventilation problem is only one pathway of ventilation is there in Prusik space. So just remember, this is the site from where the cholesteatoma starts forming due to retraction pocket formation. Okay, so negative middle ear pressure will cause the retraction pocket formation and will lead to the Prusik space formation. Also, I'll share the PPT in my Telegram group. So we'll share the link. Do join the Telegram group. I'm also videos so as to make your life easy while revision, and so that you don't miss any topic, any important topic before your examination. That will be very concise and very easy for you to revise in your last date. So do stay in touch through the Telegram group. We'll update the details there and important questions also. Now, pain in tonsillar fossa and upper part of the neck is characteristic of. So they have this X-ray is showing you one typical feature. So here something is elongated. So what it can be? On the lateral X-ray of the neck, you again saw something elongated thing is present here, which is impinging on the lateral pharyngeal wall and causing pain. So what it can be? It can be the elongated styloid process or calcified stylohyoid ligament. So typically, if you see the syndrome, so most of you know that Eagle syndrome is the recurrent pain in the oropharynx and face due to elongated styloid process or calcified stylohyoid ligament. So styloid process is just a slender outgrowth, you know, mastoid tip. So it is basically, it can cause pain in the tonsillar fossa and upper neck. And how you relieve it? The treat, the normal, if you ask me the normal length of the styloid process, it is around 2 to 3 centimeter. So variety of paper say it is 2 point something, and also range is 2 to 3 centimeter. But if it is symptomatic and if it is elongated, diagnosed on X-ray, you will do the treatment that is called styloidectomy. Styloidectomy. So how you do it? It can be done intraorally or external approach. So mostly it is done intraorally. So via the oral cavity, what you do is you first remove the tonsil, do the tonsillectomy, and then from the tonsillar fossa or the base bed, you palpate this elongated styloid process. So one way of diagnosing this elongated styloid process is to wear a gloves and just palpate it with the pulp of finger in the tonsillar fossa. So if it is elongated, you will be able to feel the tip of the styloid process, and the patient will say that yes, it is paining. So this will denote you that styloid process is elongated. So intraorally from the tonsillar fossa, you can just hold the tip of the styloid process and break its tip with the artery forceps. So in this way, you can relieve the patient of the pain, chronic pain that she is suffering. So this is called styloidectomy, right? So for now, this was a small session which I will want to end so that you don't get bored. I don't want you to lose your attention and it remain an effective session. So you can always get me in touch through the Telegram group and my personal WhatsApp, which is 8840804798. So as I am done with my examination, I'll try to help you in whatever way that is possible, in whatever time I'll get. Subscribe and share with your friends, because this will let me know that these things, because I'm trying to give my extra effort so that you achieve, and I expect same from you, that you will also give your extra effort in achieving that you desire in your life, right? So I'll end this session with a note that the present time is difficult for everyone, but have faith, have better, and things will settle for better. So this is Dr. Shivam signing off for today. Stay happy, stay healthy, and keep doing whatever you love to do. Thanks.